starring Michelle, Cynthia, Jenna, and Ruth. Good morning, Miss Cynthia. How are you? My name is Ruth. I'm going to go ahead and be your nurse for today. So, inform me, what brings you in today? What symptoms are you having?
I'm so embarrassed to say this, but I noticed that I have some warts on my anal area, and it looks like it's going to my vagina.
Okay. And are these warts painful?
It hurts when I have sex.
Okay. And for how long have you been having the symptoms, or did you notice them?
For like a month. I thought it was gonna go away, but it hasn't. I'm scared now.
Okay. And have you been able to take a look at them, or
Yeah,
is there any color to it?
like
You discharge-
whitish.
White?
Yeah.
Okay, you did say you have pain, right?
Yeah.
Okay.
And I have some bleeding as well.
Bleeding as well?
Yeah.
Okay. And it hurts more when you have
Sex,
intercourse?
yeah.
Do you have the same partner? Have you been together?
Yeah,
The same
I've
partner?
been with my boyfriend for like almost a year.
Okay. And are you aware of any other partner he may have?
No.
No? Okay. And for yourself, just him?
Yeah.
Okay. So I'm going to go ahead and let my doctor know. There might be some testing she needs to do, and then we'll just go from there. If you just want to go ahead and dress from the waist down, and then the doctor will be right in, okay?
Okay.
Okay, Dr. Jenna. So we have Miss Cynthia. She is complaining of vaginal pain and in the anal area.
Mm-hmm.
She does inform that she has probably what feels like warts. She was able to take a look. She said they are white, and she's been having it for about a month. She did say she's only has her boyfriend of a year as her sexual partner. She's not aware of him having any other sexual partners.
Okay.
I did inform her to undress from the waist down. I don't know, sure, do you want to do like the vinegar solution test?
Yes, the vinegar one.
Okay, so let me go get that, and then we'll just go in.
Okay.
Okay.
Okay. Hi there, Miss Cynthia.
Hello.
My name is Dr. Ellie, and I'm here to take a look at your you said warts in your
Yes.
anal area. Okay. Is it okay for me if you lie down on your side so I can get a better view? Okay. Nurse, we have the gloves.
Okay, so I'm gonna go ahead and pour the vinegar solution, okay, doctor? Okay.
Of the other glove. Okay. And solution. Magnifying glass. Okay, let's confirm.
Okay.
Okay, Miss Cynthia, we'll have you cleaned up. We'll have you sit back up. So, do you have any questions?
What is it that I have, doctor?
So you have what is known as genital warts. It's an STI, mainly by genital contact. How many partners have you
I
been
just
with?
been with my boyfriend.
Just with the one?
Yeah.
So just for safe measures, maybe ask here to get tested as well, so you know where the limit comes from. So for now, are you able to reach them?
Yes.
Okay. So I'll be able to prescribe you an ointment so you can self-apply.
Mm-hmm.
Usually maybe 3 times a week, and keep doing them until symptoms are gone. So, any other questions?
Does it have serum?
Sadly, it doesn't. It will go away, and then it will. Once it goes away, it will remain dormant. It's okay. It will remain dormant in your body. May come back in a year, maybe 10 years. We don't know. But if symptoms do come back, just make sure you come in and let us know.
Okay, doctor. I'm gonna talk to my boyfriend and I'll have him come as soon as possible. Thank you, doctor.
Okay, welcome.
Good morning, Miss Sanford. My name is Ruth. I'm your nurse for today. How are you?
I'm doing, I guess okay.
Okay, so tell me, what brings you in today? What have you been experiencing?
Well, a couple weeks ago, I've been feeling like flu-like symptoms, headache and fever, and I've been having some, like I have these sores on my lip and all inside my mouth, and they're like on my, in my vagina. They're really itchy. And they kind of sometimes bleed, you know, when they bust.
Okay. And have you been in contact with anything? You touched around your mouth, or what were you doing when you noticed this, or how do you think it occurred?
Well, you know, I've always wanted to do something wild and crazy. And I just don't know if I want to tell you, doctor, or nurse, but I had a threesome, and I had unprotected sex, and we did oral and vaginal sex. And I will probably never do that again.
Okay. So it wasn't partners that you're usually with?
No.
Okay. Okay. And do you know if they had anything? Did they inform you? Or you said you were drinking?
Yeah, I was drinking, and yeah, I was a little inebriated, and
Okay, no worries. So I'm gonna go ahead and do a culture. I'm gonna go ahead and swab those blisters that looks like you have in your mouth,
Okay.
and then I'll call the doctor, and they'll go ahead and inform you in regards to what it could possibly be. Okay?
Okay.
You said you also had it in your genital area.
Yes.
Okay, so we'll go ahead and do that. The doctor will come back and do that swab, but at least we can get the test going with the mouth. Okay.
Okay.
Okay. Go ahead and open. Okay. And then we will do the same thing for the vaginal area. And go ahead and send it back to the lab. Okay? So I'm going to go ahead and send this back to the lab, and then I'll go ahead and get the doctor in to go ahead and prescribe any antibiotics if needed, okay?
Okay. Thank you.
Hold on tight.
Thank you.
Okay, Dr. Jenna, so it looks like we have Miss Sanford. She's been complaining of, it looks like she has some type of blisters around her mouth, and she also said genital area. I did do a swab. I already sent the test over to the lab. She's been having it for about three weeks or so, and it looks like she had a pretty crazy night. She did have a threesome, she said, with unprotected sex, so it might be possible that she has herpes. So we'll just go ahead and wait back for the results. If you want to go ahead and talk to her.
Hi there, Miss Sanford,
Hi.
Dr. Jenna. So, until we get to know what type of STI it is, I'll be prescribing you a broad spectrum antibiotic. So until then, the 3 days after, come back and we'll tell you the results.
Okay.
3 days later, results are in.
Hi there, Miss Sanford.
Hi.
You're back again.
Yes.
So, has anything changed or anything?
No, it's just a lot of more itching and pain.
Okay. Okay. So we did get the test back results, and you do have some herpes, the genital and the simple one, which is also known as cold sores. So for that, I can prescribe you. Before I prescribe you, are you allergic to anything?
No.
Okay. So I can prescribe you an antiviral. It will help combat all the symptoms you are getting, and over time they'll disappear. But in that case, it will go away. But until it will go away and then stay in your body.
So it doesn't go away for good?
No, it doesn't. It will pop up here and there. If you're lucky, it may remain dormant for 10 years and pop up again. But when symptoms do pop up, come in again, and we'll help treat you again.
So how did I get this from having the unprotected sex?
It could be most likely because, as your nurse stated, it was not with normal people that you usually have intercourse with. So that is a possibility. But for your age range, herpes is very common amongst teenagers up until like 60 plus years old.
Oh, okay.
So it's a very common STI.
Okay, children, so from this, have protected sex. Do not have unprotected sex. Don't be a Michelle.